The incident management structure is basically how WHO organizes itself and works with partners and countries to respond to an incident, or usually an event or an emergency as we'd call it. It's structured so that in a response to an emergency, you can think about what are the core roles or the jobs that are really needed to effectively respond to, say, a sudden onset emergency, such as a disease outbreak or a disaster. And so some of those key jobs or functions would be being the leader, taking decisions, working with the Ministry of Health, working on communications, such as talking to the press, technical expertise to give, depending on what the emergency is. Say if it's a disease outbreak, you'd want to have the health experts that can tell you and share the knowledge. It also might be functions more along the lines of data management and using statistics. Maps are very essential. Epidemiologists, jobs like that. It really varies. Another aspect would be logistics, getting key supplies for the response, such as medicines or medical supplies from point A to point B is so critical, and doing it in a short period of time. It really depends country to country. So our structure here is just it's a demonstration of how WHO works in response to emergencies, but everything that WHO does is really for supporting a country in their response. The first big emergency that was really used to sort of tweak and see how it works or needs to be improved in some ways is the response to the Zika virus outbreak last year, which I think really caught a lot of headlines in February of 2016. And so as that evolved and the response evolved and it was declared a public health emergency of international concern, the incident management structure was put in place to have the core functions that I was describing at, depending on the setting, it would be at regional levels or at global levels or at national levels, depending on what would have been needed. It varies a little bit, but generally when WHO is alerted to a particular emergency or crisis, we would try to really, within 24 hours, try to activate this structure and then get sort of the organization moving in the direction of responding. And there are certain guidelines and the sort of plans of what you should do, like say within the first 24 hours, within the first 72 hours, within the first week, and even goes out 2 weeks, month, 60 days, 90 days, and sort of evolves that way. So certainly as soon as we know, we try to get it up and running. WHO is helping with the response in 50 countries at this point. I think the ones that are really headline news at the moment would be a lot of the recent Ebola outbreak in Democratic Republic of Congo, responding to conflicts and disease outbreaks in different parts of the world, particularly in Africa and the Middle East. So for example, in Nigeria, Syria, Yemen, South Sudan, Somalia. Unfortunately, there seem to be more and more emergencies of a very severe nature and scale, and there's a lot of requests for WHO and for partners, especially to help in those responses.